You're on.
Good? Okay. Let's talk about warehouse setup and cleaning, disinfecting. We've got it set up with this area here where you can pressure wash the equipment. This is for cleaning. Our disinfectant does not penetrate dirt. So you have to have a clean surface for the disinfectant to work. So we use the pressure washer to get the wheelchairs, the hospital beds that are really dirty, anything that the APPs, it works really well for. We pressure wash those. Then once those are clean, then we can bring them over here and then we disinfect them. This is kind of our staging area for once this bed has been sprayed off and cleaned now, and then we'll take our disinfectant spray right now is Maticide FD. Fast Dry is what that FD stands for. There's multiple out on the market, but whatever you're using, follow the label instructions. On Maticide, you have to spray all the surfaces down and let it sit for, how long, Chad?
15 minutes.
10 minutes.
10.
10 minutes.
All right.
15 is overkill. But
Okay.
At least 10.
At least 10.
So Shad's an overachiever. So we want to spray all the surfaces down and let it sit for 10 minutes with that on that before we touch it again. Then it's disinfected. So we've got clean, and then you've got disinfected. Then once this is disinfected, we'll wipe this down, we'll get the water spots off of it, and then we'll take this and wrap it up with some shrink wrap or a bag of some kind. It has to be covered, keeps the dirt and the dust off of it, and also we'll tag that so that it identifies who cleaned it, when it was cleaned, and then that tells the guys that are, when you're pulling it, put it on your truck, if it's bagged and tagged, then we know it's been cleaned and gone through the right process, and it's ready to go for the customer. So that is our cleaning and disinfecting process. You've got to have it bagged and tagged. Now, on the setup of the warehouse, this is we've got a dirty area, so everything that comes in that's been out with the patient is going to be put in this area. And then we pull from that to start cleaning in that process we just talked about. When you bring stuff in, bring it in with like. So we want to put all the concentrators together. We want to put all the carts together and the regulators and all these rails. Everything needs to be like with like, because this will get just a muddled mess of just really, you'll be able to put a third of the stuff in here. It looks like crap. So we want to keep this organized. Even though it's dirty equipment, we want to keep it organized as best we can. Again, this is dirty equipment, so we're personal safety, just make sure you're wearing gloves and you're washing your hands really frequently when you're handling this equipment, because you don't know what's been on it, where it's been, any of those kinds of things. But keep this area organized as best you can, because it will, over time, it just gets a real big mess. If you're really busy, this will become a huge nightmare to try to manage. Then if you've got something that needs repair, let's go down here. If you bring something back that's broken, we need to identify that and tag it and tell what's wrong with it. So we have these yellow tags that come in here, and you'll be able to see these better live, but it's what's the date, what's the item, and what's the problem with that piece of equipment. Then you take this and wire it, twist it onto that piece of equipment, and then the person that comes in to repair it knows what's wrong with it to begin with, and we're not grabbing that piece of equipment to go put out on another patient because it's been tagged. So if we go over here on some of these other things that we've got here, so we've got a wheelchair that's sitting over here. If it's ever with a yellow tag on it, this should never be put out on a patient because it's not patient ready. So this on here, it says 131 of 14, the wheelchair, the back of the seat needs to be replaced. So this upholstery on the seat needs to be replaced. It's cracked in a few places, it's looking really rough, and it needs to be traded out. Now, because that crack happens in a really kind of hidden area, this could be folded up and could be ready to go, cleaned and bagged and tagged, and you wouldn't even know it. So if something is really bad like this and needs to be replaced, don't be afraid to damage it beyond repair or so in this case, this has got to be replaced anyway. cut a big chunk in that, and you know that's not ever gonna go out again. Does that make sense?
Pretty much.
So that, don't be afraid to disassemble it or mark it in such, make it so that you definitely won't put that out on somebody, because that's a bad thing, okay? So all the repairs, all the repair stuff needs to be in one place. This is a little bit, we haven't worked on it as much. This is a little bit out of sorts. We haven't had James in here as much as we'd like, but he's a busy man. Again, this we want to put like with like. So we want to put all the beds together. We want the concentrators, the walkers, the wheelchairs. Again, trying to keep everything together. Going down over here, let's talk about our tanks. We have different sizes of tanks, and we're going to get into that, but just the setup I want you to pay attention to right now. All these tanks are in a rack of some kind. They have to be secured. These are very dangerous. If they were to tip over and bust, these things become a projectile and will kill someone. Do not leave these without a rack. They've got to be secured. They have to either be in a rack laying down like this or be upright in a rack of some kind. These are all empty tanks. I don't want any full tanks here. We want only empty tanks here. We have to keep them separated. So over here is where our full tanks will be. And again, you'll notice they're all in racks. Everything's in a rack. Always, it has to be secured. And then over here now we're starting to get in. This is where our clean equipment is. It's been bagged and tagged. So the rack has been cleaned. It's been wrapped up and it's tagged. You can see on these, I can look on this thing here and it says the E-Rack DW, David, was that David? Yeah, that would be David, and the date that he cleaned it. So if I were to pull this open, it was really dirty, then guess who I'm going to go talk to? I'm going to go talk to David. But, there's some accountability there. There's bags, then we've got our other clean equipment. We're not going to go through all of it right now, but everything on this side of the warehouse should be patient ready and bagged and tagged. Now when I say patient ready means this is a nebulizer machine. A nebulizer has got a compressor in it, and then when you wrap it up, we've got 2 nebulizer kits wrapped up with it. This is patient ready. Without those kits, this does not work. So we have to have those kits wrapped up there with it. So we want everything patient ready. So when we put that out, it's good to go. So anything on this side of the warehouse, the oxygen stuff, and we've got wheelchairs over here and walkers, they're all wrapped up, they're bagged and tagged, and the wheelchairs have footrests with them. Everything's ready just to pull off the shelf and take out for delivery. If it's not bagged and tagged, then it's got to be taken back over and put in the dirty area and cleaned again, because you can't guarantee that that's been disinfected and cleaned properly. So that's the reason why we wrap everything and clean and keep it bagged and tagged like that. That is a requirement that we're under accreditation. We have to follow the clean test bag and tag, because anything that's on this rack, an auditor should be able to pull that off and say, is this patient ready? And if they pop it open and it's not patient ready, then that's it's a demerit, or they knock your score a little bit. So it's a big deal. And I think that's about it on warehouse setup.